to talk on an Indian kitchen herb, ginger. Ginger, it is used as a cooking, as for healing and for cosmetics from centuries. In Ayurvedic classics, the ginger is known as a universal medicine, that is Vishwa Bhaishaja. Generally, it is used for all the diseases which are caused by three doshas. Specifically, it is affiliated with the Kapha dosha. That too, the diseases which are originated in the respiratory tract, that is cured by this use of this ginger. So, we will move to the derivation, how the word ginger came. So, ginger in Ayurveda is known as a Adraka. In fresh form it is called as Adraka, and in dry form it is called as Shunthi. So, we will see how the word Shunthi is derived. Shunthati shoshayati kafamaruta cheti. The word Shunthi is derived from the word Shuntha. So, this is the word that Shunthi means, which dries up the kapha and the ama, undigested food in the body. So, next, what are the synonyms which are related with the ginger? In Ayurvedic classics, every plant is explained, or its description is described in various interesting synonyms. Some are important related to this ginger are Katubhadrakam. Katubhadrakam, it is having a pungent taste. It is considered as the best among the pungent medicines. Vishwa quickly enters into the circulation due to its sharp quality. It has the sharp quality, because of this it enters the whole circulation in the body. Mahoshadam. Mahoshadam means Maha is big or the great. Aushadhi is medicine. Among the medicines, this is a important drug as considered. That is very important drug because of its strong action. Vishwa Bhaishaja, useful in all kinds of the diseases of the universe. These are the few synonyms of ginger related with the synonyms. Next, we will see what are the regional names, in which language it is called. In English, it is called as ginger. In Sanskrit, Adraka. In Hindi, Adrak. In Gujarati, Adu, and its family is Gingiberaceae family, and its Latin name is Gingiber officinale. And in classical categorization, we see the use of ginger, that is in Triptigna Gana. That means it gives satisfaction after its intake. Arshogna, it cures the arshas, that is piles. Deepaniya, it is the best carminative drug. Shula Prashamana. Shula Prashamana is its analgesic. Shita Prashamana, Trishna Prashamana, and Stanya Shodhana. In all these vargas, the importance of ginger is explained very well. In all these conditions also, we can implement the ginger. So, this is about the Gana. Next, we will see what is the habitat. It is cultivated all over the India for commercial purpose. It is a perennial herb where the rhizomes are used as rhizomes are used for medicinal purposes. In whole plant in image, you can see this is a plant of ginger where the rhizomes are used for medicinal purpose. Next, we will see what are the properties or the actions exhibited by this ginger. That is, it is well explained in shloka form, that is Adrika Bhedani Gurvi Tikchoshna Deepani Mataha Katuka Madhura Pake Rukshavata Kafapaha Ye Guna Katita Shuntastepi Santadrake Akhila. That it means Bhavaprakasha says that Adraka, that is ginger, is having Bhedan quality. Gurvi is, it is Guru in nature. Tikshna Ushna, it is having sharp quality and which is hot in potency. Deepani Mataha, Deepani is which increases the digestive fire, which is useful for the digestion of the food. Katuka Madhura Pake, Katuka means it is pungent in taste. Madhura Pake, that is post digestive effect will be sweeting. Ruksha is dry in nature. Vata Kafapaha, that it elevates the kapha and Vata dosha. Ye gunakatita shuntastepi santadrekha kila, that means the qualities which are explained for ginger are same for the dry form also, that is in shunthi also these are the qualities will be present. So, after knowing the properties, what is the dose of the juice, that is the juice which is extracted from the rhizome, that will be little, because of its hot in nature the dose will be little, that is minimum 3 to 10 ml you can take, and in powder form, that is shunthi, 750 mg milligrams to 1.5 grams. So, this is about the dose. What are the indications, in what condition, in what disease we can take this ginger? In Shwasa, that is asthma, it is very beneficial. In Kasa also, in cough, it is very useful. In Amvata, that is rheumatoid arthritis. In Ajirna, Ajirna is indigestion. How we can give, we will see further. These are the few indications, that is Shardi, it is vomiting. Recent researchers have conducted on this ginger for anti-emetic activity. That is in post-chemotherapy also. The patient having vomiting, in that condition a piece of adrak is given to chew. It prevents the vomiting also. And in post-operative cases also, because of anesthesia the patient vomits. In that condition also piece of adrak is given to chew with rock salt or honey. In Hridroga also it plays an important role. In Odema, that is, it acts as an anti-inflammatory, this is the swelling. Kanthya, it is good for throat, that is the disease which are related with the throat or the hoarseness of voice. In that condition also it gives soothness to the throat. So these are the few important indications of ginger. Next we will see what are the pharmacological actions, how it is exhibited, that it acts as a digestive, stimulant, carbonative, stomachic, that is it removes the, it elevates or it cures the pain also, anti-inflammatory, anti-diabetic and chronic COPD also. In COPD condition also we can implement this ginger, and it also acts in important drug in anti-hyperlipidemic, it lowers the lipid cholesterol also. So these are few pharmacological actions exhibited by the ginger. We will see next what are the chemical composition, the phytochemicals present in the ginger. That rhizome contains aromatic oil, starch, fat, fiber, gingiberine, gingerol, gingerine and gingerone. Gingerol is the most important key phytochemical which is responsible for the tremendous activity of the ginger. Now we will see the respiratory disorders and the ginger, how we can use this ginger in respiratory diseases. It is well explained by Priya Nigantu and Kaidev Nigantu. Priya Nigantu Kara says that Shunthiti Shushka Kathita Mahoshadam Vishwacha Naikeshu Gadeshu Sadhanam Vatanulomyaya Hitagni Deepani Sampachani Shula Kafanilapah. That means Shunthiti Shushka, which is dry in nature, Kathita Mahoshadam. He calls Shunthi as Mahoshad and Vishwa. Mahoshad is a best drug all over the world. It can be used in many diseases. Now anyone can ask how the single drug can be acting in a different or many diseases or almost all diseases. In Ayurveda we believes that every disease has its causative factor. So for any origin of the disease, the main two causative factors are there, that is improper digestive fire and one more is incomplete evacuation of the waste from the body. So these are the two factors on which this Shunthi acts, that it improves the digestive fire also, along with this it acts on a improper formation of the waste in the body also. So it cures both the conditions. So this is same applied or said by the Kaidev Nigantu also, that is Bhakshanam Lavanadrasya Rudhyam Vanni Pradipanam. He says that before taking food, this piece of adrak is taken, to this rock salt is added, which helps for Vanni Deepana. Vanni Deepana is it increases the digestive fire which is responsible for the proper digestion of the food. Rudhyam, it is good for heart also. Bhojanagra Sadhapatyam Jivha Kanta Vishodhanam. Bhojanagra Sadhapatyam means it is pathya, that is it should be implemented by every individual. Before taking food, before taking bolus of the food, one should take the piece of adrak, to this rock salt is added, which acts as a or which cleanses the mouth. Jivha Kanta Vishodhanam, it cleanses the jivha, that is tongue also, and it also cleanses the throat also, while which also helps for increase the taste also, that it improves the taste of food. Vata Sleshmaram Ruchyam Deepanam Pachanam Param. Param is the best drug for Deepan and Pachan. Deepan is which aggravates or the which increases the digestive fire. Pachana is which helps for proper digestion of the food. So both these conditions are acted by this ginger. Along with this it elevates the kapha and vata dosha. Nimbukasya rasekshiptam adrakam mukashodhanam. If we take this adrak with nimbu swarasa, that is lemon juice, it acts for as a mukashodhan, that it cleanses the mouth also. So these are the different uses of ginger. Here we can say the first mouth is considered as the first way where the infection enters into the respiratory tract. So first the hygiene should be maintained, that is proper cleansing of the mouth is also done by this ginger. Because of this pungent and bitter taste it and hot potency also, it increases the digestive fire. So this is a choice of drug in the in weak digestive fire, that it increases the good digestive fire which is responsible for the formation of all the dhatus also in the body. Meanwhile it also helps for building the immunity also. So ginger with its pungent taste clears the coating of the tongue. That is stickiness which is present in the mouth is also removed by this use of this ginger, which helps for cleansing the mouth and cleansing the throat also. For example, in running nose, or you can say rhinitis also, in asthma, in simple cough, or in anorexia, tastelessness, where we feel. In such condition, ginger juice is extracted to this honey, little bit honey is added and is taken. It is beneficial in all these conditions. Next, before taking food, if adrak is taken with rock salt, it increases the digestive fire also. Along with this, if we use this condition, the kapha dosha is also elevated. So doshas which are present in throat and respiratory tract are also cured by the use of this ginger. So these are few uses of ginger we can implement at home also. Next, we'll see what are the formulations. Formulations which are related with the respiratory system, where kasa, shwasa, like all diseases can be cured. That is Shunti Kasha is there, Nagaradi Taila is there, Shunti Ghrita is there, and Shunti Rasnadi Kashaya. So these are important few formulations. Next, we'll see the most important part is contraindications. What type of person, what type of disease, in what condition this ginger should be contraindicated, should not be given, or given with the precaution, with the precautions also. That is, the fresh ginger, that is raw ginger, is contraindicated in Kushta, that is skin diseases, Pandu, that is anemia, Rakta Pitta, bleeding disorders, and Grishman Sharad Ritu, that is in summer and autumn. In these two seasons, the ginger should be contraindicated, as these are all related with the blood. The blood is having Ushna and the ginger is also having hot in potency. So it may hamper these conditions which worsens the disease condition. So in these conditions, it should be contraindicated. So to conclude that the ginger plays an important role in treating the respiratory tract diseases by its elevating factors, that it decreases the kapha dosha also and vata dosha also. That's why the ginger is called as a universal medicine.